So hopefully that has been helpful, and you've all learned a little bit more about what viruses are and what we can do to prevent them, and a bit more about the amazing long COVID team in Rochdale and how they might be able to help you. Has anybody got any questions? Please feel free to ask anything. There is no question too small. Okay, I'm going to come over to you.
I just want to ask Ruth, obviously back in COVID days, we had to mask up and isolate. So what's the situation at the moment? What's the guidance that people need to put masks on, isolate, and so what is the latest information on that?
Thank you, that's an excellent question. So that was, do we have to isolate and should we be wearing masks? So no, you don't have to isolate any longer if you have COVID. In fact, in the hospital, we're not even routinely testing people for COVID any longer. In terms of masks, we know that probably the evidence around using masks is not particularly brilliant. But we know that probably the main benefit of wearing a mask is you reduce the risk of somebody else becoming unwell with a virus. So the main benefit of wearing a mask is to try and reduce transmission to somebody else rather than reduce the risk of you getting a virus. So if everybody wears masks all the time, it probably does help to reduce the transmission of viruses. Again, you don't have to wear them. Obviously, some people do wear them, and we do sometimes wear them in hospital, but it's probably going to help reduce the risk to others rather than to you personally. Does anybody else want to ask anything? Dad?
Well done on the work, I'm sure it's just thinking out loud, as folks spend more and more time in long COVID, and therefore they're not able to work, or maybe even have been sacked or dismissed, or in some way had to resign, financial depression and worries, I guess, emerged during your discussions.
Yeah.
How does the team respond to that, and what access have you got to offer rights advice and support?
Yeah, so Laura's here as well. You can help with that. It is a big question that we ask, because if a lot of people with COVID, a lot of people, it's kind of get the infection and it can be life-changing. They can be 34 years old, working full-time, and then all of a sudden completely gone and dropped, and they can't get to work. Mixed stories, pressures of wanting to get back to work, pressures from the employer wanting them to get back to work, and there can be this kind of cycle of trying to get them fit enough but then not push them too hard, especially when it comes to fatigue as well, chronic fatigue. That certainly plays, and we always ask kind of like how anxious people are, the depression, and then with regards to like Laura helping up, we have kind of like we call it vocational rehab. So it's how we try and get someone back into work, trying to support them through like a return phase to work and stuff like that. And then certainly from a financial perspective, we link in with our kind of communities, and there's all these different citizens advice and stuff like that we can access to, and just provide as much support as we can, really. Yeah, is that okay? Yeah.
I'm actually doing a project about return to work in long COVID, Dad, which is been granted ethical approval last week. So watch this thing.
Very good.